Hey everybody, Stahlman again. It's Friday. That means the doctor's is in live with TOA. This has been an interesting week for everybody in this country, and it's really been interesting in our world at TOA. Lots of things happening, lots of changes, lots of unknown. We're all getting through this together, however, so please be kind and patient with one another. Be careful, listen to the experts. We're going to get over this, okay? Today, I thought we'd talk a little bit about something that's come up as a very vital tool for physicians and patients in this world of COVID-19, and that's called telemedicine. And in fact, today I'm announcing that TOA will be starting a telemedicine program for our patients. So we're going to talk about that in a minute. As always with the Doctor Is In episodes, remember that while I am an orthopedic surgeon, I'm currently not your orthopedic surgeon. So anything we talk about today should be considered for educational and entertainment purposes only. This is not medical advice. If you have a problem, talk to your primary doctor, talk to one of our docs at TOA, and we can help you get squared away, okay? So again, first off, I'd like to say to everybody, we're thinking about everybody regarding COVID-19, the coronavirus, the quarantine, the changes in our lives, and the unknown involved with that. Let us not forget, here in Middle Tennessee, the victims of the tornado that happened just before the whole coronavirus thing came about. Unfortunately, in the news, everybody wants to talk about coronavirus. But we've got to think about our friends and neighbors here in Middle Tennessee who may not have a home to shelter in place at. We still have to think about those folks who don't have anything, who still need help getting their lives back together. Food, clothing, childcare, in addition to the COVID-19 problems. So please keep those folks in your hearts, okay? With regard to the COVID-19, we talked about that last episode. It's a big problem that's still ramping up. We don't know the ultimate effect on health, our economy, our daily lives as of now. The only way we'll really know about how this has affected us is kind of getting through it, which we will, and learning from what we experienced. So again, everybody is learning as we go. This is new, uncharted territory. So today we're going to talk about telemedicine. Well, what is telemedicine? Telemedicine it's been around for a long time. The technology's been around for a long time. And basically it's receiving or providing medical care remotely using technology to help us interact with patients from some distance to get medical care provided. There's kind of two words that are kind of universally used. They're a little bit different. There's telemedicine and telehealth. Telemedicine is direct communication, providing medical care or advice with a patient using communication systems, such as video conferencing. Telehealth is a little bit broader than that. It also includes such things as providing passive information to people, educational opportunities, billing and whatnot via technology. So it doesn't just include caring for patients. Now again, telemedicine is not something that's brand new. It's been around a long time. It's not been widely adopted in general population for a couple of reasons. Number one, I think the technology as far as holding real-time video conferencing has gotten much better. And number two, up till fairly recently, insurance companies have been reluctant to pay for the time for those services. in this time of COVID-19, things have really changed drastically in the last few weeks. The federal government has loosened the restrictions on the technology required to allow this type of communication with patients. What I mean by that is, before the coronavirus, all the platforms that were to be used had to be HIPAA compliant, or taking care of patient private information. So they were very secure, they were encrypted encounters. By relieving the requirement of the HIPAA compliance portion of the law, it allows physicians to use a variety of platforms, such as FaceTime, Google Duo, Zoom, these types of conferencing programs that don't encrypt the data, but allow us more broad reach to the patients. This is a temporary change. I'm hopeful, however, that as we move past all this, laws will change and technologies will change to allow us to have both secure and encrypted conferencing with patients, but much more available. The second thing that has happened with the coronavirus that makes telemedicine much more appealing to patients and physicians is the payers have now agreed to reimburse the physicians or practitioners for their time equally to the same reimbursements that they would get with a face-to-face examination in the office. That's really key, because prior to the coronavirus problem, laws in the states may or may not require the payers to reimburse the physicians. So in those areas where physicians could not get reimbursed for their time to keep the lights on and keep their staff paid, it made no sense to do telemedicine, because it was basically using up time with no chance of gaining back from that. With this temporary change, all states allow what's called parity, which is we will require the insurance companies to pay for a telemedicine visit just like it was a face-to-face visit. We're lucky in the state of Tennessee in that we already have laws on the books that demand telemedicine services be paid at the same way that face-to-face services are paid for. So it makes it a little bit easier for physicians in Tennessee to take on this new technology. The real reason why telemedicine is such a great thing initially was to serve poorly served areas or poorly served locations. So a doctor could be in a big city and treat, manage, evaluate patients in a small town far away, or in a location in a hospital that didn't have that person's specialty. So for example, telehealth or telemedicine can be used for patients in very rural communities where they don't have doctors locally, but they can essentially access the healthcare system remotely. What a great idea, huh? More recently, there's actually been technologies developed of robot telemedicine where, for example, in a hospital, a patient can interact with a live video screen on literally a robot that roams around the hospital and speak to a specialist who may not be in that hospital. So they can have an evaluation and a treatment plan created with that practitioner via video conference, and the doctor doesn't necessarily have to be right there with the patient. What that does is it helps to spread the specialty group practice to areas that may not have that specialty. Neurology, psychiatry, dermatology, Those are practices that have traditionally done very well with telemedicine. There aren't very many practitioners that are in those specialties, and so to serve the most people, we bring those specialties to the patient remotely. Now, what's happening is we're going to see more and more and more physician practices test driving or utilizing telemedicine for general medicine evaluations. We are introducing it for orthopedic evaluations. And my wife, for example, had a dermatology visit the other day via remote access. And I think this is going to be more and more commonplace. Certainly in this time of pandemic, where we're asking people to stay in their homes, to avoid contact with others, to avoid crowds, it's rather ideal to be able to speak to your doctor and have a one-on-one conversation with your doctor, and yet not be in the waiting room with all the other people who might be infected. I'm hopeful, and I think this is an opportunity for the future, because people are going to start getting used to interacting in this way. People are going to be less interested or willing to spend 2, 3, 4 hours or more in their doctor's office for a 5-minute appointment to check in and see how you're doing, when they could do it online. So I think we're going to see, coming out of the whole COVID-19 process, more robust laws, more robust technologies, and more embracing of the patients and the doctors with this type of interaction. I'm hopeful, for example, that TOA ends the coronavirus process, but we still offer telemedicine appointments. I think it's really an opportunity. There are some downsides to telemedicine. We can't examine a patient physically. Now, there are some techniques for remote access to telemedicine that allow some degree of physical examination. In some scenarios, a patient can see their physician via telemedicine, but while they're in an office with, say, a nurse practitioner or a physician's assistant, they can get their blood pressure taken, they can get their temperature taken. They actually have electronic stethoscopes so the physician can hear the heartbeat online. They can use cameras to document skin lesions or wounds, etc. And that's a very useful tool. It's kind of like the doctor has hands afar and can perform some examinations. In orthopedics, it's a little bit different. It's awfully hard to have a legion of people out there that can do the subtle examinations of the body, for example, the shoulder, the hands, the knee, the lower back, that the surgeon would. And so there are some limits to what telemedicine in the orthopedic world can accomplish. But frankly, much of what we do, especially on a return patient or a follow-up patient, much of what we do can be done simply by talking to people and observing people. So it's an interesting, exciting technology. Lots of balls in the air with regard to what's next. I'm hopeful that our physicians and caregivers around the country feel the need to implore our lawmakers to make robust laws across all the states to allow this type of technology to occur, to demand that the insurance companies cover this type of technology and interaction, because I think it really is the wave of the future. It certainly is the wave of now. So that leads me to TOA and what we're going to do with telemedicine. Right now, we're just starting our program. We are not using a formal telemedicine platform as of yet. We're still trying to get a feel for it. We are using Google Duo, which is a free download. to either your Android device or your Apple device that allows a two-way video conferencing system live. Basically, a visit is very simple. Once the patient downloads the Duo app after they've scheduled the appointment, the doctor will call, patient answers, they communicate with one another. The doctor can ask the patient to move parts or observe how they're doing. They can look at wounds, etc. In real time, the doctor also has access to your medical record, the imaging studies that you've had, for example, x-rays or MRI, and can go through what he or she sees and talk to you about what your situation is, and then make next steps. Right now, we're starting with return patients. The reason why we're doing that is because we know the patient. We have information about the patient. We don't necessarily need to have a physical examination to interact with that patient. We can do a lot of things to start the ball rolling. For example, we can prescribe patients medications. We can prescribe or order physical therapy. We can order tests such as MRIs or x-rays. And then if patients want, we can actually have them come back either to the office to go over these studies, or many times have another telemedicine conference and go over the studies virtually. There are some things we can't do virtually, such as, again, examine the patient. We can't provide an injection into a joint, for example. We can't fit somebody for a brace remotely. But many of our things that we do can be done remotely. Now, there are a lot of different platforms out there. We chose Duo because it's easy, it's available, it works on multiple platforms. It's not necessarily the best, it's not necessarily the worst. It was the platform that we chose because it was the easiest to initiate or start. There are actually companies out there that have developed robust, HIPAA-compliant, meaning encrypted platforms for physicians' offices to use. And undoubtedly, we will go to one of those platforms into the future if we continue with this project. But with the loosening of the laws due to the coronavirus pandemic, we have an easy opportunity to provide direct patient care immediately with little or no impact on cost and really no hassle for the patient. So it's a simple software download and it works from there. There are a couple of things we ask patients to try to remember during their visit virtually with their doctor. Remember, it's a two-way communication. And that means we kind of have to make sure people stop talking before someone else starts talking, because things can get confused talking over one another. It's also very helpful for you to be in a quiet, private location so there's not a lot of noise or distraction around. For example, heating and cooling units can be really noisy. Open windows can be really noisy. The television or radio on in the background can be really noisy and make it difficult to see and hear and really understand each other. Secondly, we ask patients to essentially have their device, whether it's an iPad or an iPhone or a Google phone, propped up so they can be hands-free. The reason why is it makes the picture less jiggly, and it allows the doctor to ask you to show or how things move or how things look. So you can move around, your phone's not looking at everything, it just makes it a lot easier. It also decreases that background noise that we're trying to avoid. Try to be in a well-lit but not super bright room. Don't face the camera directly into the sun, for example. Our cameras on our cell phones or our iPads are not great in the dark, So it's good to be in a well-lit but indirect light is best type of environment. Also, make sure that you have good signal strength for your internet, whether that's cellular data or Wi-Fi or both. It's important that for a good video experience, to have a good signal. Lastly, and a lot of people forget this, using video chat uses a lot of battery power. And so make sure that your phone or iPad is either plugged in or the battery's fully charged. You'd hate to have your battery go out right in the middle of an important conversation. I'm looking at my notes here. Anything else? Oh yeah, we also have some comments and questions that we're going to ask every patient. Part of this is for documentation purposes to give to the insurance company so that we can justify the telemedicine visit. One is we want to verify who you are. And what we've decided to do is ask for you to have your driver's license handy so you can show it to the physician or caregiver and they can verify, yep, that's the person I'm supposed to be talking to. Secondly, we're going to ask you where you are. Are you at home, at work, in the yard, whatever? We also need to document who else is on the call. Typically, the patient is by himself, but sometimes a spouse or a friend or another family member is with that person, and we need to know who's involved with the call. Just so you know, we are not recording these calls, okay? We don't have any intention of making these calls public. They are just a way to speak to you. We ask that if you record the conversation, that you let us know that you're recording. We're not afraid of what we're going to talk to you about. We just want to know what's out there. I think it's only fair. So we're going to ask you about who's there, where you are. Oh, and then we're going to ask you specifically two things, or tell you two things. Number one, this is not a secure network connection, which means that it is theoretically possible that somebody could listen in or hack in and gather information. Not likely, but it's possible. Unfortunately, we don't have a way to mitigate that process. If that bothers you, then I would try to make an appointment face-to-face. The second thing that we need you to understand and us to understand is that you are giving us permission to do a telemedicine visit. So we're going to ask you if it's okay for us to proceed with a telemedicine visit. And we'll document all these things so that when the bill goes to your insurance company, you don't get hassled by a non-payment, okay? The last thing, and this is the hard thing, so those people who have a copay with your insurance, most insurances, because you're not here physically to pay your copay, most insurances will tack that on to your bill. That's going to be an interesting process. We'll see how that falls out, but I just warn you about that. So, when is this happening? Well, pretty much now. I've been experimenting with it over the last week. I've had great responses from my patients. We've worked out some of our bugs. And so, essentially, starting next week, TOA is ready to schedule you for a telemedicine visit if you'd like. So when you call TOA for an appointment, they will likely ask you, would you like this to be a face-to-face or in-office visit or a telemedicine visit? If you're a follow-up or return patient, that is. We are also looking at our current list of patients who are scheduled and trying to minimize the amount of patients in the office. Again, we're trying to do our best to appropriately socially distance one another. And so we may call you and ask you, would you like to do a telemedicine visit rather than come in? And so we'll schedule it appropriately. Each visit is scheduled for a 20-minute block. That's just a space saver. we take as much or as little time as it needs, okay? But that's about how quickly it takes to get a setup done. We will also be including a link for you to the webpage, toa.com, where you can look up our telemedicine program. It will also have a link to go to a how-to video that I made this morning on basic steps. I use my iPhone, but it basically counts for an Android device as well. Basic steps on how to download the Google Duo app that allows you to communicate. I think that's about it. So it's an exciting time with regard to care. I'm thinking that this technology, once we get past the coronavirus problem, this technology will be a mainstream, commonly used way of going to the doctor, whether it's orthopedics, whether it's medicine, whether it's dermatology or whatever, into the future. If you're interested, if you like the idea, I would encourage you to communicate with your legislator, to talk to them about really making sure that we have robust laws to allow telemedicine to occur, to force payers to recognize telemedicine as a legitimate way to manage patient care, and to make sure that we have parity, which means equal, reimbursement for a telemedicine visit as we do for a face-to-face visit. That's something you can do to try to help everyone embrace this technology. Okay, that's it. I hope you have a good weekend. Remember that while there are some people out there who poo-poo the idea of the coronavirus being some sort of plot or a hoax or not as big as we thought it was going to be, it's important to understand that decisions being made to shut everything down is not meant to be punitive. It's meant to try to arrest the spread of this illness. Lots of people are going to get infected. A number of people are going to get really sick. Some people are going to die. Unfortunately, we don't have all the information in front of us to say who's going to get sick, who's not going to get sick, who's going to have symptoms, who's not going to have symptoms, who's going to die. So we're planning for the worst and hoping for the best. Please, please, please be patient. Please understand that the scientists and the healthcare advisors and your healthcare system are doing as much as we can to keep people safe, healthy, and alive. But remember, nobody has all the answers, and there is no right answer. The only way we'll know if we got it right, we got it wrong, or we got it somewhere in the middle is after this is all done. Okay? So, go back to my last video last week if you want to learn a little bit more about what we know about COVID-19 and coronavirus. Until next time, please keep your hands away from your face, wash your hands, social distancing. If you're symptomatic or sick, call your doctor. Don't just show up at their office. If you have known exposure or you do get sick, make sure people know and go out there and live your best life.